Hello everyone, you're watching sqadia.com and I am Hammad Haider. Today our topic is tendon hand injuries. We will have 5 sections. In the first section we will have the overview of what are the flexor and extensor tendon injuries and what are the closed flexor tendon injuries and how do they occur and what are the causes and what are the closed extensor tendon injuries. In the second, we'll be discussing more of an open injuries, which are mainly due to the lacerating wounds and trauma injuries. We'll be discussing its overview, its clinical assessment, and then briefly discussing the anatomy of FTP and FDS, that is flexor digitorum superficialis and flexor digitorum profundus. In the third section, we'll be moving on to the management of open hand injuries, which of the especially the perioperative care and wound exploration. We'll be discussing the extensor and flexor tendon repair, how is it done, and post-operative management following the flexor and extensor tendon injuries. Then in the fourth section, we'll be moving on to some of the other common causes of the hand trauma or the hand injuries, which include actually the flame and fluid burns, electric and chemical burns, and we'll be briefly touching upon as well on the injection injuries as well as the frostbite. Lastly, we'll be going through the secondary repair and amputation. As you know that not all tendons can be repaired adequately primarily, therefore sometimes some tendon has to be repaired in either in a two-stage procedure or there has to be a secondary repair as well once the wound heals. We'll be briefly touching on the delayed repair as well as the amputation and late reconstruction, including the reimplantation as well. Thank you very much. Keep watching sqadia.com.